We are in conversation with Dr. Ramesh Hotchandani, who is a senior consultant in the Department of Nephrology and Renal Sciences in Mujam Medcity, New Delhi. Doctor, tell us something about kidney stone disease, and does it have any regional distribution?
Kidney stone disease is one of the important causes of kidney damage and kidney failure. Northern part of our country has more prevalence of kidney stone disease because of genetic and environmental factors. Delhi and sub-Himalayan region are also known as stone belt of kidney stones in our country. Now, basically it is the problem of metabolism and excretion of calcium and other minerals from the kidney. What happens genetically or because of some kidney defect, the calcium metabolism is altered in the kidney and there is deposition of sand and which becomes stone in the due course of time.
So how can one avoid formation of stones?
See, most important thing is one thing is genetic, we cannot change that. Metabolism of the person is individualized. However, certain measures like good intake of liquids is very important. Like people nowadays with busy schedules don't take adequate liquids and water. So there is tendency for stone formation. So ideally a person should take at least 3 liters of liquid in a day. This is number one. Number two is the medications. What we have seen now, there is actually deficiency of vitamin D is seen in many patients. So these patients are taking vitamin D for years and the calcium supplements. These supplements should not be taken without supervision of the doctors. See, these are over-the-counter medicines and people are taking these medicines for years. And these medicines predispose patients for stone formation. And number three, the people who have tendencies to stone formation, they should avoid oxalate diets like brinjal, spinach, tomato and high poultry products. These products have high calcium and protein intake and these diet predispose patient to stone formation, particularly who have a family history of a stone disease, because it is a genetic variation in the metabolism of calcium and minerals. So genetically these patients have more tendency to form stone. In these patients they should take precaution in their diet as well and fluid intake.
So doctor, how do we diagnose kidney stones?
See, first the symptoms. Generally these patients come with acute pain abdomen and this is a sharp shooting pain, what we call as colic. Sometimes these stones are silent also. Diagnosis is done by very simple test of an ultrasound or an X-ray of KU region, and sometimes CT scans are also required.
So how do you treat kidney stones?
See, kidney stone disease treatment depends upon the size of the stone and the position of the stone and related complications. And it is a myth that all patients of stone will require surgery, and on the same hand I would say that all patients of kidney cannot be treated medically. So diet is important, liquids are important, and certain medicine which relax the kidney passage, they are important, and in some cases surgery is definitely indicated and patient should not avoid surgery if it is indicated.
What happens if the stones are not treated?
If the stones are not treated, it can damage the kidney, there can be urinary tract infection, there can be blood in urine, they can damage the kidneys, and in the recurrent kidney diseases, stone diseases, the patient will have kidney damage and ultimately failure. So proper treatment from an expert is desirable.